Data and evidence is extremely critical in decision making, because you want to make sure that the decisions that are made actually set the right priorities. Even when the right priority is set, you have to think about how much money to put in this program versus another program. Evidence helps you set the right priorities in terms of budget allocation, beyond just saying this is important or not. And then at a third level, even when the money is allocated, you need evidence to help you identify which are the interventions that will give you the best value for the money, that will give you the most impact. So evidence is extremely important. Some people tend to say, oh, countries like poor countries or developing countries like in Africa are too poor to invest in evidence and data. But I like to say that it's actually because they are poor, the African countries, the developing countries are poor, that they can't afford not to use data, because you want to make sure that the limited resources you have are actually giving you the best value for money. So evidence is everything. It helps reduce subjectivity when you're setting the priorities. It helps you understand what are the most critical issues you should focus on, and it helps you choose the right interventions that will give you the best value for money. Our organization works on public health in Africa, and that's an area where actually lack of use of evidence can actually lead to loss of lives. There's so much evidence that has been accumulated to actually demonstrate what can be done to reduce child mortality. One of the things that is one of the greatest achievements we've seen in public health over the last 20 years or so, especially under the Millennium Development Goals framework, was the huge reductions in child mortality across Africa. And this was basically driven by the realization of the interventions that can give the most impact. For instance, immunization, treatment of other childhood illnesses, malnutrition, and so on. The fact really being that for the most part, a lot of the evidence surrounding these sort of issues, whether it's maternal health, whether it's child health, now we're even getting into HIV/AIDS, where the treatment of people who are affected by HIV/AIDS has actually allowed many of the people who are affected by this disease to live longer. But it's a question of looking at the evidence. What is the evidence saying about what should be done and how it should be done? It's extremely important. I mean, for me, being at this meeting, it's been quite overwhelming, just trying to understand the various ways in which various governments across the globe are actually trying to institutionalize the culture of evidence use. There are specific systems countries are setting up. Just listening to how the government of South Africa, this morning there was a whole session looking at how Colombia is looking at this. Just being here and listening to what MPs are saying, whether it's Netherlands or an MP in Kenya talking about how they're actually thinking about inculcating an evidence use culture in their governments, has just been so overwhelming to me. So I look at this forum, I'm like, I go to a lot of research conferences, I go to conferences that are focusing on things like impact evaluation and so on, but this conference that actually brings together the forum that brought together the practitioners, the people who are actually have to make the decisions and are grappling with issues about how they access and use evidence and so on. It's just so remarkable, and I think it's extremely important that it should continue to share experiences, to share knowledge. And also there are a lot of failures in this field, to share the frustrations that people are actually experiencing across the globe and learn from it, so that we can embed evidence-informed decision-making, more into the culture, making it become the norm in our formulation and implementation of policies.